Okay, so one of the things that we want you to understand, but it's not important that you memorize all the details, is that acid-base balance can influence potassium balances. So when you look at this, okay, so if you're in acidosis, okay, what happens is the hydrogen ions will diffuse into the cells. And what will happen is the potassium ions will diffuse out of the cells. And what happens is it causes the membranes to be hyperpolarized. Okay, so it makes it harder to stimulate the nerves and the muscle cells. Okay, it leads to hyperkalemia. Right. Your book now, it only has like a paragraph about it, and it doesn't even have this picture in it anymore. So don't get hung up on this. Okay. Another thing that can happen is if we're in alkalosis, okay, the hydrogen ions will diffuse out of the cells because we need the hydrogen ions outside of the cells to bring the pH back to normal. And we'll end up with too much potassium in the cells, and we'll end up in hypokalemia, and that can cause problems too. Okay, now, disorders of acid-base balances, and I only have 2 slides on this. I know you guys did a lab activity on it, and we can talk about it when we do the review. There are 4 common disorders of acid-base balances. So there's respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. Okay, so respiratory acidosis is like the most common kind of imbalance that we're going to see. So what happens typically is the rate of ventilation falls behind the amount of carbon dioxide that we're producing. So things that can influence the rate of ventilation, you guys could think about this. So maybe what's going to affect the removal of carbon dioxide from the blood. So things like COPD, asthma. It could be something with the heart, like congestive heart failure. It could be a cardiovascular disorder. So all of those things that are going to affect gas exchange and getting the carbon dioxide out are going to cause us to go into respiratory acidosis. So what will happen is as our carbon dioxide accumulates, the pH will go down. Okay, and that's bad. So the way that our body will try to compensate for it is it will try to speed up our respiratory rate. Okay, respiratory alkalosis is caused by hyperventilation. So if someone gets scared or someone gets, upset and they're breathing too fast, then they're actually eliminating more carbon dioxide than they're producing. Okay, and will become basic. Okay, so the goal with this is to slow down respiration, and they sometimes say breathe into a paper bag. And what that does, essentially, sometimes it just makes you conscious that you need to slow your breathing down, but it also will recycle the carbon dioxide, so you're inhaling it, bringing it back in. Okay, now metabolic acidosis is acidosis that is coming from something other than respiratory. Okay, so it's something more systemic. Okay, so it could be due to alcoholism, diabetes. If someone has untreated diabetes and they're making lots of ketones, so they're burning fats, it leads into ketoacidosis. That's a case of metabolic acidosis. Acidic drugs, they're using a lot of acidic drugs, or for some reason they're losing base, so they have a lot of diarrhea and they're losing hydrogen or hydroxide ions. Okay, so our body, to compensate for this, is going to change our respiration rate, and we're also going to hold on to hydrogen ions. Okay, metabolic alkalosis is pretty rare, doesn't happen very often. Things that could cause it are bicarbonates, like if somebody's taking a lot of Tums, it can cause it. You'd have to eat a lot of Tums. Or if you're losing acid a lot, so you're chronically vomiting. Okay, now, the way that we're going to compensate, okay, so respiratory system's going to adjust the ventilation rate. Okay, so this is going to be fast compensation. It's going to happen like within seconds or minutes, but it's not super duper powerful, right? It's not able to totally get rid of hydrogen ions or hold on to hydrogen ions. Okay, so if we have hypercapnia, which is an increase in CO2, so increased CO2, that's going to stimulate pulmonary ventilation. Our respiratory rate's going to increase. Okay, hypocapnia, which is decreased CO2, it's going to slow down. Okay, now renal compensation, it takes longer. Okay, it takes longer, but it is more powerful, and I want you to get that. So if we're in acidosis, our kidneys are going to excrete more hydrogen ions. And if we're in alkalosis, we're going to excrete the bicarbonate ions and hold on to the hydrogen ions. And we can talk about this more when we review.